would like to bring to your kind attention to all of you that the increasing prevalence of kidney diseases all over the country and all over the world. Especially in Hyderabad, we have been finding that so many youngsters are getting into kidney diseases nowadays. The most common cause of kidney failure all over the world, especially in our country, even in our setup of Hyderabad, is diabetes. The diabetes is increasing in its prevalence all over the world, basically because of the change of lifestyle and the food habits and the sedentary lifestyles predominantly. So, I feel that the increasing prevalence of diabetes ultimately will lead to the kidney failure, and 30 to 40% of the diabetic patients are likely to develop kidney failure. And of all the patients with kidney disease, the predominantly 30 to 40% of the patients are supposed to be having a diabetes underlying. So, second followed by high diabetes is actually the hypertension. The high blood pressure is contributing to 40 to 50% of the mortality in among the kidney disease patients. So also we have a significant other kidney disorders like chronic tubulointerstitial diseases, glomerulonephritis, autosomal dominant polycystic kidney diseases, kidney stones, kidney infections, and so many other conditions. So, all of them are culminating ultimately into kidney failure. So, we have divided the kidney disease, chronic kidney disease into 5 stages. And it is very unfortunate to note in our country that we have been finding out the patients with the kidney disease and ultimately in stage 4 or stage 5. And within few months after detection of the kidney failure, they are landing up in a dialysis stage. So, dialysis stage is almost the last stage. Unfortunately, we are finding them very late. It may be because of the lack of awareness among the people and the lack of knowledge about the kidney diseases even among the physicians treating the patients across the country. So, it is very important for us to increase the awareness among the physicians to send the patients or refer the patients very early to the nephrologist, and also once the disease is detected, the patients should be able to stick to the doctor and go to him regularly, get a good follow up and get a treatment properly. And there are so many myths and taboos and misconceptions about kidney failure and the dialysis. See, dialysis is a wonderful procedure which has been invented to safeguard the lives of the people with the kidney failure. And when it comes to 100% kidney failure, then only the dialysis program will get started. So, everybody thinks that if the moment they said that there is a kidney failure or kidney disease or kidney damage, they think that they are getting into dialysis. It is not true. So, it is only when kidney fails 100%, then only they can go for kidney dialysis. So, dialysis is a wonderful procedure which saves the lives of the people who are otherwise supposed to be losing their life because of kidney failure. I appeal to all the people who should be knowing about the kidney failure and the dialysis. The dialysis is a life-saving procedure, never intended to trouble the people or harm the people or something like that. So, followed by there are 2 varieties of dialysis programs are there in the world. One is a hemodialysis. Hemodialysis is a program where you are supposed to come to the hospital and get treated for 4 hours. Then after 4 hours you can go back to your home and you have to come again every alternate day to the hospital. So, this is one such procedure. And one more procedure is called continuous ambulatory peritoneal dialysis. Continuous ambulatory peritoneal dialysis is a process where we can insert a small tube inside your stomach through a small procedure of 30 to 40 minutes procedure and under local anesthesia. Then you can actually send the fluid, 2 liters of fluid into the abdominal cavity where it gets filtered properly, and whatever the toxins are there in the blood, they will get into the fluid. Whatever good products are there in the fluid, they will go into the blood. So, that is how then afterwards we can drain out the fluid from the abdominal cavity. So, this can be done 3 to 4 times a day at home itself. So, you do not have to go to the hospital. So, you can do all the dialysis procedure at home itself. Then the third and the most important and the most reliable, dependable and the treatment of choice in kidney failure patients is the kidney transplantation. Kidney transplantation is a wonderful process for the past 60 to 70 years. It has been doing very well across the world. Unfortunately, there may be some problems and the complications related to the kidney transplantation, but ultimately a kidney failure patient deserves a kidney transplant unless proved otherwise, unless proved unfit for kidney transplantation. So, everybody with a kidney failure can go for transplantation unless there are some other complications which might deter him to go for kidney transplantation. In our country, as per the Human Organ Transplantation Act 1994, it is only the parents, siblings, spouse or the children only can give the kidney, that is father, mother, brothers, sisters, children or wife or the husband. So, among these people only can donate a kidney. No, any other transplantation is actually illegal and that is not acceptable even scientifically, because these are the people who can actually share a good tissue matching with the recipient, that is the kidney failure patient. So these people only can donate the kidney, and a kidney transplantation is an elective process. There is no emergency in that. You don't have to go for transplantation very early the moment you are told that you have a kidney failure. So you can actually go to a hospital, get treated by the doctor, maintain on a good hemodialysis program, then one day on elective day you can go for kidney transplantation. And even after transplantation you will have some complications. The most important thing is that how to avoid the complications. So no procedure can be so simple, and no procedure can be totally and without any complications. So you should be adherent to whatever the drug therapy, whatever is given by the doctor, and the drug therapy should be strictly followed, and all the drugs, the doses, everything should be known to you, and you should go to the doctor frequently and regularly so that you can avoid the complications. The most important complications after the kidney transplantation is the infection, and if you can avoid infections, you are almost safe. And there is one more complication called rejection, where the human body detects that your kidney actually is a foreign one and not your own. So it will try to send it out or throw it out forcibly. That is called acute process of rejection. So how to avoid rejection? It is actually the doctor's responsibility, and you will see that your life is safeguarded by an effective management of immunosuppressive drug therapy. The drugs which are given to you after the transplantation is called immunosuppressive drug therapy. This is actually double-edged sword. It is actually one way it is going to help you, other way probably it might trouble you also. The dosing, the number of times, the doses of each and every drug is very, very important to know. That is why it is actually something like a tightrope walk. If you have an excess dosing, you are likely to get into more infection related complications. If you take less doses, probably you are likely to get rejected with the kidney. So it is actually, you should be able to fine monitor the drug therapy in a proper way. That is why you need to go to the doctor properly. So it is very, very important for you, every patient with a kidney failure, to know about hemodialysis, continuous ambulatory peritoneal dialysis, and kidney transplantation. So see, no longer an organ failure can be a problem for any human body. So because we have a wonderful replacement therapies in the form of dialysis, transplantation, every organ, almost a good number of organs are having a transplantation process, of which the most time tested, efficient, and without many complications is the one with the kidney transplantation. So anybody with a kidney failure need not really get bothered or get troubled, and there is a wonderful program called hemodialysis and CAPD and transplantation. So unfortunately, we have been watching so many youngsters are getting into kidney failure nowadays. It's not just the diabetes. Around 30 to 40% of them are having a diabetes. If they develop diabetes in 20s and 30s, they are likely to develop kidney failure in 30s and 40s. So likewise, after that it's a hypertension. But a good number of the children or youngsters where there is no reason why they are developing into kidney failure. It is very, very difficult. Most of the time some of the genes are able to affect. There may be some environmental pollutants and the toxins which are contributing to the kidney failure. So we need to be aware of all these things, and we have been doing some kind of a research in our country also. The Indian Council of Medical Research has recently started a CKD task force in our country. It has selected 9 cities across the country, basically the major cities and the metro cities, of which Hyderabad is also included, and it has selected 9 centers, and every center in their own city will do some prevalence based study to know how big is the issue in individual cities, so also ultimately in the country. I am fortunate enough to be associated with Indian Council of Medical Research, and I am one of the principal investigators from Hyderabad, and we will be shortly doing this kind of a survey across the state, across Hyderabad, predominantly to see what is the prevalence and the etiology of kidney failure in our group of people in Hyderabad. In fact, the human body will never really take it seriously as far as individual organ prevention, disease prevention is concerned. It is actually the holistic way, and the entire human body should be taken into. So whatever the health related aspects are being considered for a healthy body or a healthy lifestyle should be followed for everybody, not only for the sake of kidney, for the entire human body. So also like brain, liver, lungs and everything. So you should be able to take less of non-vegetarian diet if at all you really intend to take preventive steps to against the kidney failure. So non-vegetarian diet, especially the animal protein, is likely to increase the volume of filters in the kidney called glomerular hyperfiltration. So they are supposed to damage the kidney ultimately. So we advise the people not to take non-vegetarian diet and try to lessen the body weight, because the larger the body, the more the metabolic activity by the body and more ultimately the pressure onto the kidneys. So we tell the patients to decrease the body weight and quit smoking immediately, not to take alcohol, and try to have a small and frequent meal so that they can avoid diabetes and hypertension, and take a lot of healthy food, and see that the physical activities takes place in their routine daily schedules. So that's more ultimately important. See, if you can really follow a healthy lifestyle, you don't have to worry about an individual organ, be it heart, be it brain, or be it kidney. Ultimately the human body is more important. Every organ is equally important. So a healthy lifestyle ultimately prevents every kind of or any kind of a disease, not just the kidney disease alone. Thank you.